This is Mahalakshmi, President Endocrine Surgeon at Sankhya Hospitals. Primary hyperparathyroidism is a condition associated with high blood calcium levels due to overproduction of parathormone by parathyroid glands. Parathyroid glands are small pea-sized glands situated adjacent to the thyroid gland in the neck. Primary hyperparathyroidism is often associated with adenoma, that is, tumor of the parathyroid gland. Most commonly affects women, and about 3% of postmenopausal women may be affected with primary hyperparathyroidism. Various symptoms like polyuria, that is, increased frequency of urination, polydipsia, increased or excessive thirst, fatigue, muscle weakness, bone pains, kidney stones, gastrointestinal disturbances like nausea, vomiting, peptic ulcer disease may be associated with primary hyperparathyroidism. Some of the studies show almost 51% increased risk of hip fracture and also increased risk of stroke and heart attack by 45% in individuals affected with primary hyperparathyroidism. Surgery is the mainstay of treatment. Postmenopausal women with high blood calciums, that is more than 10 milligrams per deciliter of calcium, should get evaluated for primary hyperparathyroidism in order to avoid the risks associated with primary hyperparathyroidism. Fracture with trivial trauma, that is, a person may sustain fracture following fall from standing height. Fractures with trivial trauma are also more common in primary hyperparathyroidism. Various psychiatric disturbances like depression and also mood swings can happen with primary hyperparathyroidism. Often neglected and ignored entity in patients with fatigue, muscle weakness, and non-specific bone pains. Patients with these symptoms and blood calciums above 10 mg% should be evaluated for hyperparathyroidism. Management of primary hyperparathyroidism includes various diagnostic modalities like ultrasound, 4D CT scans, and sometimes nuclear imaging for localization of the tumor and removal of the offending gland from the neck. Many medical treatments like calcium mimetics and bisphosphonates are being used for control of primary hyperparathyroidism. But surgery is the mainstay of treatment, though medical management is selectively indicated in very few cases.